Picture two bearded dragons side by side. One is bright-eyed, standing tall on straight legs, moving with total ease. The other has legs that are permanently locked into an unnatural position, a jaw that sits slightly crooked, and a body that never grew the way it should have. Both of these dragons could have started life exactly the same. The only difference between them is what happened in their first few months of care. Today, we are not doing a standard bearded dragon care guide. Instead, we are doing something far more useful. We are breaking down exactly how these preventable medical conditions happen, why baby dragons are so unforgiving of mistakes, and precisely what you need to do differently so your dragon never ends up like the second one. Welcome back to the Reptile Lab. Bearded dragons have a reputation as an easy beginner reptile, but that reputation hides an uncomfortable truth. During their first year of life, bearded dragons grow so rapidly that any mistake made in their diet, lighting, or enclosure setup does not simply pass. It gets locked into their skeleton, their organs, and their long-term health, sometimes permanently. This is why so many experienced keepers actually argue bearded dragons are a poor choice for total beginners. There is very little room for trial and error while their bodies are forming. Today, we are decoding 5 of the most common medical conditions seen in captive bearded dragons, what causes each one biologically, and how to make sure your dragon never develops them. Sign 1. Metabolic bone disease. Metabolic bone disease, often shortened to MBD, is one of the most devastating and most preventable conditions in the entire reptile hobby. This condition occurs when something goes wrong in an animal's care that permanently deforms their skeletal structure, and it can affect virtually any part of a bearded dragon's body. It shows up most visibly in the front legs, where the limbs can become locked into an unnatural forward position, but it can just as easily affect the jaw, the back legs, the spine, and the tail. A dragon suffering from advanced MBD can often still walk, but every single step places abnormal, uneven pressure on joints that were never meant to bear weight that way, and that added stress tends to compound over the course of the animal's life. The most common underlying cause of MBD is inadequate UVB lighting. UVB is one of 2 critical light sources every bearded dragon needs, alongside a proper heating element, and its role is to mimic the effect of natural sunlight during basking. Without going too deep into the exact mechanism, the short version is this. UVB exposure allows a bearded dragon's body to properly synthesize vitamin D3, which in turn allows them to absorb calcium correctly from their diet. Without sufficient UVB, calcium simply cannot be processed the way it needs to be, regardless of how much calcium-rich food is being offered. The bones do not receive what they need to grow correctly, and they begin developing improperly, sometimes staying smaller than they should, sometimes locking into distorted positions as the animal continues to grow around a skeletal structure that is already compromised. Here is the part that should genuinely concern every owner. Once significant skeletal deformity has occurred, there is limited evidence that it can be meaningfully reversed. Correcting lighting and diet after the damage is done can absolutely stop the condition from progressing further. But based on long-term observation of dragons living with these deformities for years under corrected, ideal conditions, the existing damage tends to remain exactly as it is. A dragon that develops locked front legs as a baby will very likely have those same locked legs a decade later, even under perfect care. Metabolic bone disease does not necessarily end a dragon's life. Many dragons live a full, decades-long lifespan with these deformities, but they typically require permanently modified enclosures, often smaller and simpler, because the extra distance required to move between a water bowl, a basking spot, and a hide creates cumulative joint stress that becomes more uncomfortable as the animal grows heavier over the years. The second major driver of MBD is an improperly balanced diet. This is where a huge number of preventable cases originate. It is extremely common for owners to notice their dragon strongly prefers only 1 or 2 specific foods, and to simply keep offering those same foods because the animal is eating something. The problem is that even a well-loved, consistently eaten combination can leave massive nutritional gaps. A diet of only feeder insects and 1 type of fruit might provide plenty of protein and vitamin C, but bearded dragons require a much broader nutritional foundation that includes leafy greens and a variety of vegetables, with fruit kept to a smaller, occasional portion due to its sugar content. Live insects play a critical role here, and there are 2 additional steps that dramatically improve their nutritional value. The first is dusting, coating insects in a calcium and multivitamin powder before feeding, which adds nutrients directly onto the food itself. The second, and far less commonly discussed, is gut loading, feeding your insects nutrient-dense foods like collard greens before offering them to your dragon, so that when your dragon eats the insect, they are also consuming everything nutritious that insect recently ate. A general guideline many experienced keepers follow is a ratio of 2 parts calcium supplement to 1 part multivitamin, dusted consistently over feeder insects throughout a dragon's early development when their skeletal needs are at their absolute highest. The second major issue is stunted growth, and it is deceptively easy to overlook because a stunted dragon can still appear cute, active, and outwardly healthy. The danger with stunted growth is entirely internal. A dragon that never reached their proper adult size may have organs that developed in a body far smaller than what nature intended, and there is no way to visually confirm whether that compressed internal structure is causing long-term complications. It is a quiet, hidden consequence that most owners never think to investigate. Stunted growth is most commonly caused by one of two factors: parasites or chronic nutritional deficiency. Parasites are relatively uncommon in captive-bred bearded dragons under normal conditions, but the risk rises sharply if a dragon is fed wild-caught insects collected outdoors, since those insects frequently carry parasites that transfer directly to the reptile that eats them. Once parasites take hold, they compete directly with the dragon for nutrients, consuming resources the animal desperately needs during the exact window of life when almost all of their growth potential is concentrated. Bearded dragons do the overwhelming majority of their growing early in life, so a parasite infestation during that critical window can permanently cap how large that dragon ever becomes, even after the parasites are fully treated and eliminated. The second driver, chronic malnutrition, can be sneakier, because a malnourished dragon does not always appear thin. In some cases, a dragon can maintain a seemingly normal body weight while still being severely undernourished, simply because the calories being consumed are not translating into proper bone and muscle development. The result is an animal that looks proportionally fine at a glance, but never reaches the size, strength, or structural development it should have. Both parasites and poor nutrition point back to the same underlying lesson. What happens nutritionally in the first several months of a bearded dragon's life effectively determines their physical trajectory for the rest of their decades-long lifespan. Sign 3. Stuck shed and necrotic limbs. The third issue is one that seems minor on the surface but can escalate into one of the most severe conditions on this entire list: stuck shed, medically known as disecdysis. Bearded dragons shed their skin in patches rather than all at once, unlike snakes, which typically shed in a single continuous piece. This patchy shedding pattern means old skin can easily become trapped in small areas, particularly around the toes, the tail tip, and occasionally the eyelids, especially if humidity levels are not adequate to help the old skin separate cleanly. When shed becomes trapped around a toe or the tail, it behaves exactly like a tightening tourniquet. As the dragon continues to grow, that retained band of old skin does not stretch or loosen. It tightens further, gradually cutting off blood circulation to everything beyond that point. Without adequate blood flow, tissue begins to die. If left untreated, this progresses to full necrosis, and the affected toe or tail segment will eventually need to be surgically removed to prevent the dead tissue from spreading further up the limb and threatening the animal's life. This is not a rare freak occurrence. It is one of the most frequently seen preventable injuries in bearded dragons that pass through rescue and rehoming situations, and it is entirely avoidable with basic humidity management and prompt attention whenever shed appears to be lingering past its normal timeline. Stuck shed on the eyelids presents its own serious risk. If shed accumulates and is not addressed, it can eventually force an eyelid to remain closed. Once that happens, fluid can build up behind the closed lid with nowhere to properly drain, occasionally progressing to infection. In more severe cases, this requires a manual flushing procedure to clear the buildup and preserve the eye entirely, something that becomes far more complicated the longer it is allowed to persist untreated. There is a second, related contributor to tissue death in bearded dragons, and it connects directly to heating rather than shedding. Bearded dragons require genuinely high basking temperatures, often reaching well above 100 degrees Fahrenheit, in order to properly dry off and regulate their body effectively. If a dragon frequently sits in a damp, cool environment, such as remaining wet after a bath without adequate access to strong heat afterward, that persistent moisture creates ideal conditions for bacterial growth on the skin. Over time, this bacterial buildup can contribute to tissue breakdown in exactly the same way that stuck shed does, particularly on extremities like the tail tip, where circulation is already naturally reduced. Ensuring a dragon has access to a genuinely hot, dry basking area is not a luxury addition to their enclosure. It is a direct line of defense against exactly this kind of preventable tissue damage. Sign 4. The danger of improper substrate. While loose substrates like sand or walnut shell bedding are often marketed toward bearded dragon owners, they carry two significant, well-documented risks that connect directly back to several conditions already covered in this video. The first and more commonly discussed risk is impaction, where loose particles are accidentally ingested during feeding and become lodged inside the digestive tract, sometimes requiring emergency veterinary intervention to resolve. The second, far less discussed risk relates directly to one of the more obscure medical issues in this hobby: clogged femoral pores. Male bearded dragons have small, pore-like structures along their inner thighs that secrete a waxy fluid used for scent marking and communication in the wild. Under normal conditions, this fluid should remain clear and release naturally without any visible buildup. But when a dragon is kept on loose substrate, particles can physically become packed into these pores. Once blocked, the secreted fluid has nowhere to properly exit. It backs up, dries out, and continues accumulating as the dragon keeps producing more fluid behind the blockage. Over time, this creates a visibly protruding, uncomfortable buildup that stretches the pore itself and can, in severe, untreated cases, begin damaging surrounding tissue from the inside. Preventing this condition comes down almost entirely to substrate choice and routine hygiene. Non-loose substrates such as tile, reptile-safe mats, or paper-based lining eliminate the physical mechanism that causes the blockage in the first place. Regular bathing, roughly once every 1 to 2 weeks in warm water, also helps keep femoral pore secretions loose and able to naturally clear on their own before any serious buildup has the chance to form. For cases where blockage has already progressed to a visible, protruding stage, gentle, careful manual expression during a warm soak is sometimes used by experienced keepers, though this should only be attempted with proper knowledge, care, and confidence, since improper technique risks tearing delicate tissue and causing a far more serious injury than the original blockage itself. Every single condition covered in this video traces back to the same handful of root causes: inadequate UVB lighting, an unbalanced or overly narrow diet, insufficient heat, poor humidity management, or inappropriate substrate. None of these are exotic, rare, or difficult to source requirements. They are foundational elements of basic bearded dragon husbandry that are widely documented and readily available to any owner willing to research them before bringing a dragon home. The tragic pattern seen across so many rescue and rehoming situations is not one of malicious neglect. It is almost always a pattern of good intentions paired with incomplete information. An owner who genuinely loves their dragon, but was never taught the specific, non-negotiable requirements that species needs during the critical early stages of life, when their body has the least room for error. Every deformity, every stunted limb, every case of stuck shed, and every clogged pore covered in this video represents a moment where a small, fixable gap in care was left unaddressed for too long. The encouraging part of all of this is that every single condition we discuss today has a clear, well-understood cause, and every one of those causes is entirely within an owner's control. Proper UVB lighting from the very first day of a dragon's life, a genuinely varied and nutritionally complete diet, correct basking temperatures, appropriate substrate, and simple routine care like regular bathing are not advanced-level husbandry skills. They are the baseline foundation every bearded dragon deserves from the moment they enter your home. If you already have a dragon showing any of these signs, do not panic and do not blame yourself for what has already happened. Correct the underlying care. Immediately, consult an experienced reptile keeper or a genuinely qualified exotic veterinarian if you are ever uncertain, and focus on giving that animal the best possible quality of life moving forward. Every dragon deserves an owner willing to learn what their body actually needs. Keep researching, keep learning, be patient, have courage, and be kind.